Hi, today we'll be talking about insulin and diabetes management. Do you know that in diabetes patients, insulin therapy gives the maximum HbA1c reduction? So let us understand what is insulin. Insulin is a hormone produced by pancreas and it helps in regulating the blood glucose. In the absence of insulin, the body cells cannot use glucose as a source of energy. So what happens? How is insulin secreted? Even in a fasting state, that is when you are not eating, certain amount of insulin is continuously secreted, which is known as basal insulin. And when you are eating, the blood glucose increases and simultaneously the insulin secretion also rises. Now this is the process that is affected in certain patients of diabetes, and therefore insulin needs to be injected from the outside in these patients. So let us bust certain myths and bring forth certain facts about insulin. So myth number one is that if we ask a patient to initiate insulin, he or she feels that they have failed in managing their diabetes. So that is not a fact. The fact is that type 2 diabetes is a progressive disease, and over a period of time, body's insulin stores, they get depleted. And it is only a logical option that exogenous insulin or insulin from the outside is started, especially when the oral medications are not working. Now, second myth is that insulins do not work, and even after starting insulin, the blood glucose didn't show much of a difference. Well, the fact is that insulin is basically the best treatment for diabetes. And sometimes titration of up titration, down titration of the amount of insulin that you need, that is needed. And if it is not done, then the blood glucose may not show, desired results. So insulin is one thing that for sure works. Now myth number 3, that insulin causes complications. Well, it is a complete myth. And it is not insulin that causes complications. In fact, if insulin is started early in the course of the disease, then a lot of complications which are associated with high glucose and uncontrolled diabetes, those complications can in fact be prevented. Now, myth number 4 is that patients feel that insulin leads to weight gain. Well, certain patients are prone to gain weight after initiation of insulin, but that is mostly because the blood sugars have remained very high, and during that period weight has been, muscle mass has reduced and weight has been lost. So it is that lost weight which is actually regained after initiating insulin. And if you are following proper lifestyle modifications, then insulin doesn't lead to excessive weight gain. So another myth is that once I start off with insulin, my life will change, or my quality of life will reduce, or what will office colleagues and relatives say when they see me taking insulin injections. Well, you have to forget all of these things and you have to believe that it is your health which is of primary importance. And if at all your life is going to change, after insulin, your life is only going to become better. You will feel more energetic, the rate of infections will reduce, your muscle strength will be better, and overall you will feel more positive. You will not want to give up on insulin. So myth number 6 is that insulin causes hypoglycemia, where the newer types of insulin, they are much safe in terms of hypoglycemia, and if there's proper education, if the oral anti-diabetic agents are properly modified, if insulin is taken in the correct dosage with the correct timings, and the meal timings are also adequately adjusted, then there are very less chances of having hypoglycemia. So myth number 7 is that insulin is too expensive. Well, insulin is usually less expensive than many oral anti-diabetic agents, and there are a whole lot of insulins which are available. There are cheaper options, there are more expensive options. So whatever suits your pocket, that can be started. And if you need insulin, and if you aren't taking insulin, and if your blood sugars are high, you're obviously prone for acute and chronic complications. You're prone for hospitalization, and one single hospitalization will cost you much more than the entire cost of insulin. So think about it.